Untreated obstructive sleep apnea can affect head to foot, all organs, because of the fundamental issue of oxygen deficiency. Untreated sleep apnea and because of this oxygen deficiency can lead to malignancy, cancer in the long run, WHO data.
Sir, can snoring be a serious health issue?
If snoring is associated with obstructive sleep apnea, that means it is not simple snoring anymore. He is a patient of OSA.
Hello everyone, welcome to Vitadell Healthcare. This is Srimay Bhattacharjee, Center Head, and today we are in conversation with Dr. Dipankar Dutta sir, a renowned ENT specialist in Kolkata, and he is also a specialist in sleep apnea and snoring. Welcome to Vitadell sir.
Thank you. Hi everyone.
Sir, what is snoring and why do people snore?
It is nothing but some sound generated in the upper airway because of some obstructions at the level of from the nose, throat, and people snore whenever there is some block. It is kind of mechanical obstruction resulting in sound by the basic principle of physics.
Sir, what is sleep apnea and how is it different from regular snoring?
Sleep apnea is not equal to snoring always. Rather, on the contrary, snoring is not equivalent to sleep apnea always. Snoring, when coupled up with breath-holding choking spells during nighttime sleep, associated with arousals, followed by daytime sleepiness, excessive tiredness because of fragmented and unrefreshed sleep, is known as obstructive sleep apnea. So, obstructive sleep apnea, one integral symptom is snoring, but not all snoring are sleep apnea because there are some entities which is known as simple snoring. Because of some limited block in the nose, people can snore, but may not be associated with this choking episode, oxygen level desaturation, and daytime sleepiness. If not there, that is not OSA.
So, what are the common causes of snoring?
Any kind of obstruction or block. The commonest reason is kind of mechanical obstruction because of obesity. And if the person is not obese, there might be some nasal septal deviation, there might be some polyp in the nose, there may be high-grade tonsil, big bulky tonsil, or in pediatric age adenoid hypertrophy, maybe thick bulky uvula and palate, maybe there are some tongue-based hypertrophy and maybe short jaw. This is extremely common, particularly in Southeast Asian subcontinent and Eastern Indian region, where people are not obese, but we get sleep apnea. Non-obese obstructive sleep apnea because of structural issues, because of some resistance and obstruction because of narrow maxilla, narrow mandible, and short jaw. So any kind of obstruction are the commonest causes of snoring.
So, what are the symptoms of sleep apnea?
So the symptoms are most commonly the snoring, first of all, followed by breath-holding choking spells, arousals, excessive daytime sleepiness, early morning headache, frequent nocturia means urge of going to basically pass urine at the night, and in extreme cases there might be associated other comorbidities like diabetes, hypertension, arrhythmia, ischemic heart disease. In long term, there are some neurocognitive symptoms we find in our patients like depression, mood disorder, memory loss, and early aging and Alzheimer's also.
Sir, how can I say if my snoring is a symptom of sleep apnea?
Already told, actually when snoring is coupled up with breath-holding choking spells, arousal, if there is a daytime tiredness, and there is a questionnaire, Srimani. There is a questionnaire known as Stop Bank questionnaire. This is very relevant and gold standard question across the world, where actually we ask our physician colleagues, the primary care physicians, to trace obstructive sleep apnea from their general OPD patients. STOPBANG, it is a mnemonic where S stands for snoring, T for tiredness, O stands for observed apnea, P stands for pressure, means whether the patient is hypertensive or not, B stands for BMI, that means whether he is overweight at the category of BMI more than 35 or not, A stands for age, whether age is more than 50 years or not, N stands for neck circumference, that is whether there is a thick neck like 40 or more than centimeter of neck size, and gender male or not. If the answer to any one question is yes, we score 1, and if answer to any one question is no, we score 0. So total out of 8, if the cumulative score is more than equal to 5, he is a strong suspect of obstructive sleep apnea. So this way a general person can also screen whether I have sleep apnea or not, and whether I need medical attention or not.
So, what are the health risks associated with untreated sleep apnea?
Top to bottom, what not, Sri? What not? Untreated obstructive sleep apnea can affect head to foot, all organs, because of the fundamental issue of oxygen deficiency, chronic oxidative stress, we call it. It can affect your cardiovascular system, it can affect your pulmonary system, it can affect your neurocognitive system. So, hypertension, then ischemic heart disease, arrhythmia, and apart from that, this COPD, asthma can be aggravated, gait diabetes, become succumb to the glycemic control insufficiency because of obstructive sleep apnea, then this Alzheimer's, mood disorder, anxiety, depression, and apart from that, untreated sleep apnea and because of this oxygen deficiency can lead to malignancy, cancer in the long run. WHO data came up in last few years. So it affects all organs of our body, including even kidney, fatty liver, all.
So, can snoring be a serious health issue?
Obviously, provided if he is a simple snorer, maybe he needs just attention to the treatment of nose only. We treat the nose, we treat allergic rhinitis, just simple management of allergic rhinitis, be it some allergy avoidance, be it some pharmacotherapy, kind of anti-allergic medicine or spray, patient can be relieved. But if snoring is associated with obstructive sleep apnea, that means it is not simple snoring anymore, he is a patient of OSA, then that needs serious medical attention because of the reason already I have told. Well, there are so many comorbidities probable which can be associated with an untreated OSA. So it needs medical attention, must. So I snore, my ancestors also used to snore. This should not be the attitude. It needs medical attention.
Sir, aren't there any home remedies or lifestyle changes which can reduce snoring?
Wonderful. Obstructive sleep apnea management actually starts with lifestyle management. Healthy lifestyle is the key. The fundamental crux is maintain your weight. Don't allow to become overweight. So by doing good diet, physical activity, exercise, proper sleep hygiene, like proper time going to bed, the time should be fixed, and preferably to avoid supine position, that is don't lie on the back. We ask our patient or sleep apnea patient to preferably lie on the lateral aspect, that is on the side, or maybe lie on the chest, that is prone position. In Bengali we call it upur hoye shoa, right? So don't lie on chit. So preferably avoid the supine position. These are the fundamental basic lifestyle, means weight reduction, exercise, and sleeping posture. Apart from that, there is a concept came up in last few years, and there is a hot topic in our subject all across the world, that is oromyofunctional therapy. This concept is known as sleep gym. Means not only just whole body exercise, you are actually targeting your muscles of the upper airway, because sleep apnea is a block of the upper airway, I have already told. So there are some exercise maneuvers which can enhance the tone of the muscles of the cheek, palate, uvula, neck, tongue, to enhance the tone of the muscles so as to prevent collapse during nighttime sleep. So these are the fundamental home remedies, and avoid allergens. Lifestyle modification. The mainstay medical management of obstructive sleep apnea is CPAP, that is continuous positive airway pressure device, and there is a gadget called mandibular advancement device or oral appliances.